our meeting to order. First of all, is there any public comment out there that anyone would like to bring an issue before the board? Please let our electronics person know that by raising your hand or however you can.
It sounds like B Squared Beacon has public comment.
Okay, B Square.
Can you hear me?
We can hear you. We can't see you, but we can hear you.
That's good enough. You don't want to see me, I assure you. First of all, I appreciate the opportunity to make a public comment or to, in my case, ask a question, because the open door law does not require you guys to entertain public comment, but you do, and I appreciate that. So today I wanted to float a question to the board, and I understand that there's no requirement that the board provide any response, especially because there's not a spot on the agenda today for the new strategic plan, and my question relates to that new strategic plan. So at a previous board meeting, you discussed the inclusion of some wording in the new strategic plan draft that characterized racism as a threat to public health. And I took an initial look at the data on race disparity for COVID-19 vaccinations broken down by county. And it shows that the percentage of vaccinated people who are Black is less than the percentage of people in the general population who are Black across the state for every county, and that includes Monroe County. So in Monroe County, as of February 13th, 1.66 of those vaccinated were Black, compared to about 3% of the general population that's Black.
Are those adjusted for age, Mr. Beacon?
I don't know. These are just the raw numbers. There was no age data. It was just race data.
We don't know if they were actually eligible or not.
Yeah, we raised that question. We're going to look into that. That's part of our meeting today.
Okay. So in any case, I mean, those numbers, sort of in layman's terms, about half the number of Black people are getting vaccinated so far compared to the number you'd expect if the vaccine distribution were proportional to the representation in the general population. And of course, that's independent of age and any other variable besides just the raw numbers.
Eligibility based on risks.
Yeah. So in any case, I mean, I assume, you know, it's obviously not okay for us to say, well, the Black population is vaccine averse. That's their choice. There's nothing to be done about that disparity. And, you know, to be clear, I don't think anybody's saying that. But my question is, you know, in light of the new strategic plan and the possible wording that might be going in there, what, if anything, does the board plan to do to address the racial disparity in COVID-19 vaccinations? And it sounds like there is something in the works. So that was the extent of my question, and I appreciate the opportunity. Thanks.
Thank you so much for your comment.
Is this something appropriate for us to talk about when we talk about vaccination at that time?
Certainly.
I think that might be the best time to talk about it.
Okay. Anybody else out there?
There are no other hands raised.
Okay. One of the things I should have done when we first started is introduce each of us, because there are people on today from the public. I'm Kay Leach, and I'm the current chair for the Board of Health. I'm going to ask board members to also briefly just mention who they are and how long they've been with the board. Mark, would you start?
Yes, pardon me. Mark Norrell, and I'm senior lecturer in healthcare management and policy at the O'Neill School of Public Environmental Affairs. I've been on the board for 6 years-ish, something like that, and finished up my term as chairperson on December 31st, 2020.
Okay. Dr. Wren?
I'm Dr. Robert Wren. I'm a retired obstetrician and gynecologist in Bloomington. I've been on the board for about 3 or 4 years, and I help with the future planning clinic.
Thank you. Dr. Talukian?
I'm Charles Talukian. I'm a retired pediatrician, and I've been on the board for, I don't know, 25 years, a long time. Almost as long as George Hageman, but not quite.
Dr. Hageman?
I'm a retired microbiologist taught from the biology department at IU until 2003, and I really don't remember how long I've been on the board. It's been quite a while, though. We go way back, right, Carol?
Right, longer than me. That's how long he's been on.
Carol. Ashley?
Hi, my name is Ashley Craner. I'm the vice chair for the Board of Health. I got my master's in public health from Indiana University, and I'm also the chief deputy recorder for Monroe County government.
Thanks, Ashley. We won't call on you too much today with your bad throat.
Are you having a hard time
Penny?
hearing me?
Our administrator, Penny, would you like to introduce yourself, Penny?
Sure. Penny Cottle, the administrator for the health department. I've been in the position since 2008.
And I see a little telephone down here which says Dr. Sharp. Dr. Sharp, are you there?
I'm here, and I'm a retired family physician and have been the health officer since the 70s.
Yep. Dr. Sharp, I think, has been on with the health department longer than anybody here online. And also I can't see her, but is Margie on?
Hello.
There she is.
Hello, I'm Margie Rice. I'm one of the Monroe County attorneys. I'm assigned to the Board of Health, and I've been a municipal lawyer since 2002.
Okay, that's who we are.
Did you get Steve Pritchard?
Oh, did I leave Steve out? I'm sorry, Steve. I didn't see you on my screen, so I must have left you out. Go ahead, Steve. Thanks, Carol. Steve's a little delayed because he's in Florida. Steve, can you hear us? Well, I know Steve's going to be on and off because he's having some technical difficulties from Florida. So we'll show Steve when he comes on board. Okay, next on our agenda, let's approve the minutes. Minutes of January 5th. Have you had a chance to go over them?
Yes.
Any corrections?
No, I move approval of the minutes of January.
I did find one little itty bitty correction. If I can find it. It was is instead of, maybe not. Maybe it was on February I found it. Go ahead, Mark.
I move approval of the January 5th minutes.
Second?
Yeah. We have a motion and a second. All in favor?
Aye.
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 Raise your hand. Okay, Margie, is that acceptable?
We're actually supposed to take roll call votes during
You told
COVID.
me
So if we
that
could do
before.
roll call, that'd be great.
Okay, I think you told me that before and it kind of slipped my mind.
That's totally
Okay.
fine.
Okay, Cranner,
Yes.
Hedgeman,
Yes.
Norrell,
Yes.
Richard. Still can't hear from him. Okay, Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So the minutes stand approved. How about February the 2nd minutes?
I move they're accepted as written.
I will second that.
Okay, we have a motion and a second. All in favor, Cranner,
Yes.
Hedgeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So those minutes stand approved. All right, next are public health reports. Is Amy? Oh, there's Amy. Amy Meek, go ahead.
Good afternoon. I don't really have anything significant to report. I really just wanted to jump on in case you had questions for me. Our vaccine clinics kind of continue as they have been. Our health department site at the convention center, we did have to close this past Monday for weather, but those people have all been moved to this coming Friday. So we have an extra day in there to get everyone scheduled this Friday or next week, but they've all been called and rescheduled so that they didn't miss getting their vaccine. I looked at the numbers really quickly before this meeting, and it looked like the convention center was nearing our 3,000 mark for vaccines. Our IU health sites have given almost 32,000 vaccines at this point. So the IU health sites are continuing to get the Pfizer vaccine, and our health site is continuing to get the Moderna vaccine. And right now our allocations look like they're going to stay the same. We haven't had any notification of those increasing. So we'll be staying the course.
Amy, how many are given like through the pharmacies? I know Kroger's been giving vaccines. How much are, you know, have any idea how many they're actually doing?
Penny might know that. I don't know the numbers that they're getting.
I don't, and today on the call that the state, if I understood correctly, that's not coming from the state's allocations, it's coming from the federal pharmacy allocations. So I'm not sure.
They told me that when I was there the other day, they told me that they're only about a week out in terms of making appointments, which is nice.
Since I'm supposed to get mine on Friday, Amy, is that going to be a really, really long day? Should I bring my dinner?
I'm sure they'll get you right through there.
Do you know how many are scheduled for Friday?
I don't know. There's probably around 250, but I'm not sure the exact number.
Well, I think they've been doing around 300, so they should be able to handle that easily.
Yeah.
Oh, Amy, I have a question, please.
Go ahead, Mark.
You mentioned that IU Health has administered something, what did you say, 27,000 or something?
Almost 32,000.
Almost 32,000.
Mm-hmm.
And that's not just of Monroe County residents. That's in their entire, that's like in the regional distribution.
So that's really true for the health department site too, because you can sign up any place to get vaccinated. So you don't have to live in your county to get vaccinated there. But definitely at the hospital, we've seen a lot of people coming from all over to get vaccinated.
Right. And I presume somebody is tracking that, like, you know, I presume there is somebody knowing how many vaccines have been administered for Monroe County residents.
That's on the vaccine website. So if you go to the map on the state's dashboard, that represents the number of residents.
So even though like you get one in Brown County, it gets reported as one from Monroe County.
Mm-hmm.
Okay.
Thank you.
Amy, what are we doing about underserved populations right now as far as vaccination?
So we still have to stick with our, state regulations as far as 65 and older. Mm. We have taken some vaccine to a couple locations where we know they were 65 and older and just vaccinated that population. But until that opens up more, that kind of limits us on what we can do there.
So we don't really know who's underserved and so forth until we get more data or more people are able to get vaccinated?
Well, so for example, if we wanted to take vaccine to one of the shelters, we could only still vaccinate people who are 65 and older at the shelter. We couldn't vaccinate just everybody who's there.
Okay.
So
that would not prevent us from doing outreach to underserved populations, either geography or individuals targeting underserved populations that are over age 65. That could be done, and I assume that the staff are doing that somehow.
Well, just kind of to address that, we do have a group. So Nicole has been kind of leading this committee group task force. I'm not sure what to call them, but that's working to address how we can meet the needs of our underserved populations, be they fear or hesitancy on the vaccine, whether it's about language barriers, whatever that inequity or disparity may be. So we're looking at messaging, we're looking at how we can encourage vaccination for people who may be hesitant, all of those things. And that group of individuals, we've been meeting every couple of weeks, perhaps. So trying to look at how we can increase that. Right now, we really can't, we don't have vaccine to take out and do outreach. We have that in our plans and we have every intention to do that. But the vaccine we have right now is for appointments that are scheduled. So if we take vaccine away from the convention center clinic, for example, then we may not have it for people who have appointments.
So, okay, so my question, can you hear me?
Mm-hmm. We can.
My question is when you're giving the vaccine, are you collecting any race or ethnicity data? So you guys will be able to tell us of those, let's say 1,000 you give out, those 65 or older, how many of those were Latina or African American or Asian?
Yes.
Okay. I think that's kind of what is going towards the question that Square Beacon is asking.
But it is, yeah, it's collected in the system. And then that's what is, so right now on the dashboard, on the front facing dashboard, it's the state's demographic data. But I think what Mr. Askins had pulled up, so if you dig, you can go in and do a search on the specific demographic information and numbers. So I think that that's where he had pulled his numbers. So we can look at that. But again, there are variables in there that we don't know right now. Yeah.
I think that you could probably predict that there will never be enough supply if you're just kind of going by appointments made. You know, you're always going to be sort of in this position of not having enough to, quote, do outreach, right? So, you know, maybe there's a way to think about reserving some for those populations, those underserved populations, instead of just saying, okay, well, we're just barely keeping up with the people who are going online and making a reservation. That's an access issue for those underserved people. So is there the latitude of holding out?
Not at the moment. We have plans to do that, exactly what you're talking about, but at the moment we do not have that latitude.
And why? What is preventing that from happening? Like, what do you refer to? What is the latitude? When you say we don't have the latitude, what does that mean?
Well, our allocation is for the clinic. We do not control the schedule. The state controls that. So the vaccine that is allocated for our clinic is what goes up on those appointments.
That is actually out of our control.
Yes.
So the next question is, you mentioned a task force. Or I don't know, you know, it's a group of people.
Yeah.
Is there a deliberate attempt to include those underserved populations, the Black populations and Latino? Are they on that group? Because that's the question that we would want to ask. We want to ask them rather than, you know, sit around ourselves and figure out how do we think is the best way to do that.
Yes. Yes, sir. We have a variety of people on the committee that works directly with and invited others to the table. Yes.
Right. And maybe my last comment is, you know, there's such good evidence-based things out there now with regard to messaging to those populations. And, you know, there's, and this is the good thing about this sort of high profile issue of a pandemic is you have all these researchers out there who are doing this good evidence-based study about how to get to these populations. And there was an article in Scientific American in early January that very specifically went after those populations. And it wasn't just Black folks. It was surprisingly, Scientific American identified about six groups that were vaccine hesitant or had access problems. And it was Republicans, and it was service workers, and it was those that are aged 30 to 48 or something like that. But that there's such good evidence-based messaging information about how to actually convey that message. So, and I know you're aware of that. I'm just saying that, you know, maybe just for public consumption, that we're following the evidence in terms of how we message.
Absolutely. And we are glad that there is an abundance, you know, of other qualified people who are doing that, and glad to be offering that. And we do have other groups within the department, sort of, we put different staff to kind of look at. We know we're still going to have some seniors who, you know, are homebound, and the state's putting together a program for homebound, but we're trying to merge all of the different things that the state's trying to put together and we've got in our plans, and merging those so that we're not duplicating efforts and then missing somebody else, you know, and having a gap there. So absolutely.
So it sounds to me right now that your hands are basically tied in terms of what you can do. And other than doing outreach to try to get those people who are vulnerable, to get them appointments, but that you have a group working on when vaccine supply becomes more available to be able to do more outreach to those groups. And I'm assuming that you have faith-based people on your group. Because that's a really good outreach.
They have been reached out to as well. Yes.
That's a good group, I think.
Yeah, I know that the hospital side, Amy may talk to that. They've reached out, and we've had that discussion, trying to pull together some very specific names and people to help us. So we've gotten some guidance on that. One of the plans that we have, hopefully, you know, that IU has indicated the willingness to open up a large vaccine site for the community, not just for Monroe County, but as kind of a regional hub. As we noted, people can come from anywhere. And our intent and hope is that we can get a large amount of vaccine there, and then still have vaccine that our staff, we can spend more of our staff devoted to some of those outreach activities. So that's our goal.
I've seen Dr. Sharp's slide come on several times. Are you wanting to say something also, Dr. Sharp?
No, I'm not sure why my light would be going off, but I'm just listening so far.
Okay, all right.
Could I ask a question? I hope you can hear me okay. My connection is a little questionable. It appears that Nicole, according to the chat here, I think Nicole Wagner is part of that working group. Could we, and they're meeting, I think she said maybe tomorrow at noon. So could we maybe at our next meeting get a report from Nicole that reports on what the outreach, what they're doing and what they're actually suggesting?
Certainly.
If we could do that.
Love to hear that.
Do you know where they're meeting tomorrow at? Or no, it's Zoom, isn't it?
It's a Zoom meeting, yes.
Yeah.
So if there's a member of the public that wants to join that's listening in, they can certainly email us and we can get them that link.
Okay. Okay, Penny, I think you're next. Or Amy, did you have anything else? I'm sorry.
No, really, I was just here to answer questions today. So that's it.
Anybody else have a question for Amy? You're doing a great job. Thank you.
Thanks for all your work, Amy.
Yes, thank you, Amy.
Thanks a lot.
Okay, so what I want to start with, and you know, we've gotten a lot of good feedback about the clinic, but I had an email this morning that I just wanted to share with you. A woman, I assume a female, but maybe not, but someone sent me an email this morning that said that their 80-year-old mother had received their second dose of vaccine at the convention center, and they were very grateful. They had accompanied their mother to both appointments and could not be more impressed. It ran with utmost efficiency and professionalism, and everyone was kind and helpful. So we've gotten multiples of those. So just a shout out to everybody, and so that you get that. So I didn't have to send you another email, but to share that with you. And I will say, you know, all of the staff and the volunteers, as I've said before, have been great. Christina Kemp frets over every detail. And the whole team and staff and volunteers are working very, very hard and to ensure that excellent service that this person received. So wanted to share that with you. We do have just kind of in the staff reports, 2 new retirements coming up. So we will be continuing to recruit strong candidates to fill those positions. We did, as Amy said, we had the vaccine closure yesterday. IU Health also closed their vaccine clinic yesterday and today. And our testing sites were closed yesterday and today, and they should reopen tomorrow. The Optum site, I believe, is going to open a little bit late. All of those appointments are being rescheduled or have been rescheduled, so no one should be without their appointment. And then I think, you know, just in general, and this can come up more in the regulations. We've had some discussion, it came up last time, that the Greek houses are looking at fall for their housing capacity and their leases. And so just some questions about that will come up, and sleeping space, those kinds of things. So we continue to just do the normal things at the health department. Kudos to staff these last couple days for some of them have lived close and went into the office to take care of phones or urgent matters. Others have been working remotely from home. So just a shout out to them for doing their work.
Anything else, Penny?
I think that those are really the highlights that in the last couple weeks. We've met, we're starting to meet with IU again regularly to look at the Greek housing numbers as they've had re-arrival testing. So far the numbers have remained pretty low, so that's good.
I would just encourage you all to try to make some plans for the fall, at least keeping in mind that they may or may not change, you know, but it's really hard, I think, for a lot of the Greek houses to, because they have contracts to sign, and they, you know, this has been a really hard year financially for all of them. And so if we can not wait till the last minute to do this, so it'd be a nice thing.
Yeah, many of them, you know, I know that I've gotten at least 1 or 2 emails that they plan to ask for an exemption. Others we've talked with, they're going from maybe 50% capacity where they are now, but up to that 75. But it will mean that they'll have to be taking more liberties in terms of kind of where the desired or recommendations are versus the regulations with sleeping arrangements. Some of them have had specialists come in and look at how they can arrange their beds to make sure that they're 6 feet apart, but they may need to use some bunk beds or something like that. So they weren't necessarily out of compliance with the regulations, but they would be kind of on the edge of what was considered ideal. But for most, the main concern is exactly as you talked about, Dr. Talukian. It's about being open, and that if they are not at that 75% or or higher, that they have to look at whether or not it's feasible to be open. So.
Okay, anything else? Under old and continuing business, it says regulation discussion. Would you like to take this, Penny?
Sure. So again, just kind of moving right in, what a good transition. We don't necessarily have recommendations for changes currently for this semester, for this term. The things that I just really want to point out, I don't think need action unless you disagree with something, but we've had some questions about guests and not being allowed on the property, not just in the house. So I do believe that as we wrote those regulations, they were not supposed to be at the facility, meaning not in on their porch or in their courtyard, not there, right? Because if they're outside and they have to go to the bathroom, they're probably going to go inside to go to the bathroom, or they may still be exposed. Again, we are receiving questions about the fall and whether or not you will likely increase that capacity. I have expressed right now, and I think IU has said the same thing, at this point, we just don't know that there will be changes. And they would probably be best off to plan for it to stay at 75%. But that is something I think that we need to continue to watch and consider. And then, as I mentioned, just for awareness, that sleeping space is also kind of a question. We had, again, at least one that noted to go to 75%, which they would probably have to do in order to remain open. It may mean that they were using some bunk beds. They would still place them per guidelines, but that they may be used where they're not ideal or recommended. One possible suggestion to think about is perhaps to allow for an increased capacity if they have a high level of vaccination in the house. So perhaps if 90% of the members or the live-ins have been vaccinated, that they could increase their capacity. Certainly right now, they're not in that eligibility group. So that also assumes that they'll have the opportunity to be vaccinated, which I think will happen, but that's just one idea that we had that might be an option to allow them to increase capacity.
You know, my only hesitation about that is we have no idea how long this vaccination is going to last.
Yes.
I mean, we don't know anything about the vaccine, just like we don't know anything about COVID. I mean, I'm not sure that that's a valid thought.
Right. And not asking to do that tonight, you know, hopefully we'll get more information on that as we go forward, but just something to think about.
Yeah, I think we definitely don't, we just need to give them as much lead time as we possibly can. You know, I just felt bad for a lot of the houses in the fall. Everything was changing so rapidly, and we ended up making some regulations fairly late that they were, and I just would really like to do that as much in advance as possible. So I know everybody else does too, but I'd just like to reiterate that point. And I certainly would be in favor of allowing them to increase the capacity. Well, it's going to have to happen at some point if they've been vaccinated. You know, if they've been vaccinated, I think increasing capacity just makes sense until we find some other information that indicates that would be the inappropriate thing to do. But I don't think anybody knows that at this point.
The infectiousness and virulence of the new strains is a big question mark.
Well, and I'd rather err on the side of continuing to be conservative, because we can always open it up. It's easier to open it up and allow more in than to kick them out.
You know, you're right, Ashley. It was really stressful last fall when, like, all of a sudden there was the announcement that said, "Oh, it's not safe to be in congregate settings," and these kids are all scrambling around trying to find other places to live, and you know, it was really stressful for the students last fall. I talked to a lot of them, and it was really hard on them. So I agree with you. It's better to start out with,
and then somehow do like a wait list or something. You know, when things start to get better. I mean, they can handle that on their end, but you know how they pick and choose who gets to come back into the house. But I think that's the best advice we could probably give them is to take the most, you know, that's the angle we'll go for. It's the most conservative right now.
Yeah, not all their funding comes from people who live in the house either. A fair amount of it comes from the kids who live out and have what are called parlor dues. So they pay money to come in and have meals in the house and participate in activities in the house. And certainly if things are better in the fall, that's an easier thing to expand on than it is to say people have to move out.
Yeah, for outside activities too.
Yeah, so so I think that there are ways to, you know, to make things, if things are going well and there's a high vaccination rate and it seems like it's working, then you can expand letting other people come into the house who are same vaccinated and, you know, that kind of thing, as opposed to you know, saying, you know, you're at 75%, but you know, but now we're going to go down to 50. And that was really hard on the houses and on the kids last fall.
Hey, Penny, I had a question. I had a question about the Navica app. Are you familiar with that, Navica? No. So I went to go do the Morton street testing for my vaccination, you know, to do a test, and accidentally wound up at the vaccine place, which, by the way, was amazing. Those people were running up the hill, catching people with walkers. There were police, volunteers. It was an amazing setup over there.
At the hospital?
Yeah, it really was. I was so impressed. Anyway, when I went to Morton, though, I got this app called Navica. They had me sign up on it. And it stores all my test results.
Oh, it's brand new. It just launched today, I think. Mm-hmm.
Well, I went in there it was like 2 weeks ago. If you can hear this, you'll understand why I went. But the great thing about it is that it stores all of the dates and your test results right there in an app on your phone. So like if my employer needs to see or questions a negativity test, I have it literally right here on my phone. So that was something that Morton was offering. Actually, it required me to do it. Or there was a sign up there to do it. So I did it. But anyway, I wanted to throw that forward that this is a very handy little app that allows us, and my results came by way of state.
Right. From what you're describing, I think it's probably something that our site manager was able to connect with. But the state just announced today, and it's not supposed to go live until today or tomorrow. So there will be a portal for people to get all of their results just like you're describing.
Okay, very awesome, because this is very handy. That'll be great. Okay, super.
Yeah, the only other thing, and I agree with everything that you all said, I'm going to play advocate for the houses for just a moment, and just goes back to making decisions early when we can, is that people are signing their leases. So if they're not in the house, they are going to be renting apartments. They will not be able to come back into the house once they have another lease. So. Not trying to move you to a decision tonight. I'm just throwing that out there on behalf of them.
What should we work on this specifically at some meeting soon? Because, you know, again, I just feel like we just need to work on this in a more timely manner than possibly we did in the fall. I mean, we had a lot of things on our plate back then. So, you know, I'm not faulting anybody, but I just, you know, we do know how it happened then. And I'd just like to work on this thing.
I think that would
fall, right, Penny? We're talking about fall.
We're talking about fall. They're not asking for changes now. They understand what this year is, and And I think the big question is just that we don't know what the fall will bring, but I totally agree with all of you that the sooner you can tell them if you're sticking to 75% or if you're going to look at changing it one way or the other, the sooner you can confirm that for them, the better.
Well, I think it's important to stay at the 75% until we have a good reason to do something else. So, and there's no way we can predict what that's going to be. So they're going to have to work with the 75%, and then they can, and then possibly at a later time we could change that.
And also, you know, to tack on to what Dr. Sharp said, I think that there's liable to be a lot of pushback on that coming up with the numbers that we're seeing now that look quite positive, right? I mean, you know, right now that trend is sharply downward, right? But we know ourselves that there are threats to that with the variants that Dr. Hegeman just talked about. You know, so we are reluctant to kind of relax things, even though I think we're going to get a lot of pressure in the next month or two to relax things.
I agree completely. I think we should stick at the 75%, let them know that for next fall, just so they can plan. On the other hand, I think that just because the occupancy is 75% doesn't mean that there aren't things that, if things are going really well and there's a high vaccination rate, there's not things that they can do inside the house to, you know, to make life more livable for them, which has not been this year, frankly. It's been really hard for them because they can't even eat together. I mean, it's like, yeah. So there's things if things are going well, then we can expand other things besides occupancy for them to make their lives a little better. But we can't decide that right now. But those aren't things that are going to make a whole lot of difference other than maybe their food contract, which I don't think they do until later. So, I mean, so the question, we need to make decisions before any other, you know, in a timely manner for their contracts, basically is what I'm trying to say.
Well, following up on what Steven said earlier, like maybe should we like pick like a time frame here where we should meet specifically about this to make decisions? So should we do something, have a meeting specifically around housing, like in end of March, April, after March, you know, after March Madness comes and things settle down? Do you guys want to do that, or?
Well, you know, they're signing housing contracts now. That's the problem, and and I don't see any reason to change any of our regulations at this point. I just think I'm good with it. Does anybody feel like they would need to change regulations at this point?
No.
Anybody?
No.
No.
So it sounds to me like that what we should be telling them is that our regulations will stand for this fall in terms of occupancy. However, if things are going well, we may be able to make some concessions, but we won't know until later in terms of, you know, activities and dining and, you know, other members from outside coming in for meetings, that kind of thing. But those don't have to be done ahead of time. It's the occupancy that's really important. And I don't see any reason to change it.
No, I think we're all unanimous on
that. The mitigation testing when the kids came back, the positivity rate was 0.23% for these kids that had been gone for some months.
There's already been some houses that have been put on warning, right? Is that right, Penny?
Yeah, actually, that did not include. There's a separate number which is a little greater than that for the house, for the communal living, but it's very close to that 0.23%. That's really pretty incredible.
That is impressive.
And to add to that, I think that the university has mitigation tested such a high percentage of those students, right? So maybe that's a consideration that we have, is that if the university is going to continue to, you know, do such a good job with their mitigation testing, then that's an early warning that, you know, maybe we could sometime shortly, you know, tell them that their occupancy could go up if they continue to mitigation test so aggressively, and that rate is down in the 0.1%.
But it could just be because they all had COVID last semester and they still aren't going to get it.
Yeah.
Carol, the issue is that they really need a decision now, isn't that right? Because of all of the contract and
They do.
signing.
Well, the decision, I totally agree with the decision being same as last fall, 75%, because we do need quarantine rooms and we need to be able to separate it out. 75% is not a bad thing for communal living. But again, that's not written in stone. It could easily go up, but we don't know how loose people are going to get, any breaks or whatever. We have no idea what's going to happen, but they can plan on 75% and then work with it later. I would hate to go up right now, but it's up to the board.
I think it sounds like we're on the same page there, actually.
I think we've all
Yeah,
said that we don't see it going up.
Yeah. Has anybody seen any other data about how long having COVID, for the most part, protects you? Because right now we're operating with 90 days. Is there any other data that shows that perhaps you're protected any longer? I've not seen any, so.
Yeah, right now, even with the vaccine, 3 months is the limit that you have in terms of not having to go into quarantine. If you're fully vaccinated, it's been 2 weeks since your second shot, and you're asymptomatic. If you're a close contact, you don't have to quarantine, but that's still that 90 days. I think they just don't have the data yet to extend that.
No new data. That's too bad. We need better
Sure,
data.
it'll come.
we need better answers.
They'll be
Epidemiologists
forthcoming.
who are using crystal balls say everything from there's going to be another surge in July to that we're on the downhill side of the slope.
Yeah, we're making it all up. So.
Well, so there's some immunity from having the infection for some period of time, and some period of time after the vaccination where you have immunity. And so that's 1 + 1. And I don't know if that equals 2 or 4. It's just hard to say where we're going to be even in a month. But it should
Absolutely.
progressively get better.
It should. Even the Spanish flu went away after 2 years.
Even what did?
Spanish flu, 2 years took it to go away, but it did go away. It took 2 years.
Yeah.
They didn't have vaccination.
Okay, it doesn't sound like any change in decisions today.
That's
What
what I
about-
expected.
What about regulation discussion? We did that. How about local health maintenance fund carryover?
Well, yeah, I did want to talk just briefly about the community regulations. Again, don't necessarily have any recommendations to change anything at this point, but I did want to, again, just share that we've got some retail food establishments, some bars who are wanting us to ease restrictions. We are concerned that there could be an uptick in cases kind of post Super Bowl that should be, if we're going to see it, may not be seen for yet another week. We do have March Madness. We have lots of things with potential, including the variants, which is probably the most concerning thing that could happen. So we would recommend that we kind of stay where we are for the time being. You are meeting frequently. If our cases per 100,000, when that drops below 100, then we probably will go into blue in that advisory category. So at that point, you may want to think about easing the closing time. That would be the one change that we put into place for bars when we went to orange was that early closing of 1 a.m. So that might be something you would consider changing and seeing what happens after that. And again, we can look at the numbers at your next meeting and maybe have more recommendations, perhaps as we move down. Right now we're trending in a good direction with our cases per 100,000, but still being in that 30 to 99, for example, is still, a lot higher than we would like it to be, but we might be able to consider maybe changes as things continue to improve, whether it's allowing bar seating with a barrier or things like that. So that I'm not recommending those things tonight. We would recommend that you keep things where they are for the moment, but those might be things that you think about and that we come back to you with a recommendation on, maybe at your next meeting if things are continuing to trend in a good direction.
You might point out to the bar owners that we're meeting frequently and we're considering this in a continuous fashion, so that changes may be imminent.
Are there any specific requests that they're making?
They would like to have bar seating. They would like to have, I think, a later closure. Some of them, of course, would like to have standing and dancing, but that's not allowed per the governor's order. So it really doesn't matter if we would allow that right now or not. But I think the early closure and then
current governor orders expire.
Right now at the end of the month.
Okay.
Yeah.
The bar seating can, if like the country club and the American Legion, if they pull a small round table up to the bar and have people sitting facing each other rather than facing over the bar, that's not an unreasonable thing because they're not, they're not close to anybody and they're not facing anybody. But anyway, that's something they can think about. Did you follow that?
Yeah. Isn't one of their big gripes about not being to serve over the bar? So you got all these people sitting up by the bar, but they have to come out and walk around, or they have to have servers or something.
They would like to have bar top service, meaning they want people seated at the bar. Mm-hmm. Right.
Again, the problem with that was 2 or 3 hours sitting there drinking and eating with no mask, facing forward where the bartenders are, and the lemons and limes and all the glasses and all the. I mean, that's just common sense that you don't want somebody sitting there for that long a period of time with no mask, facing the bartender and all the equipment and food.
I'm not sure I want people breathing on my food, even if we didn't have COVID.
Exactly. I was at a bar recently where the waiter, I couldn't believe it. The silverware was in all in containers. And he picked it up out of there and then he set it down on the table, and he also put their glasses down, holding the rim. I mean, I very rarely say anything, but I talk to the manager about training the staff a little better than that. Even when it's not a COVID thing, you should not be handling where people drink out of the glass. And he literally had touched the entire rim of the glasses when he put them down. It was pretty bad. Is anybody there?
Yeah.
Yep, we're all here.
We're here.
It got awfully quiet.
We were seeing,
Hear you.
there was another comment. If not, are there any board member comments? Well, I have one or two. First of all, I'd like for us to reflect in our minutes that the board has now completed its 2020 self-assessment. And Mark put all that in a beautiful graph for us, a beautiful format, and it's been sent out to everybody. Additionally, we also completed our evaluation on the administrator and the health officer for our accreditation. And that's been done, and that's been sent to each individual. So I'd like for us to reflect that in the minutes. And also, Margie, can you give us an update on any of the bills at the state, how that's going on, or with any news from our lobbyist or anything?
I sure can. Well, I can tell you generally, I have no specific information about any particular bills, but I can tell you that this is the week that they are picking, whether they're going to committees or not. So we're going to know more, our lobbyist thinks, after this week. There's a significant threat, I would say, to home rule power being levied at the state. And so that's something that they're watching. So, we get a report from him every Friday, and the report last Friday was simply, that he's continuing to watch certain bills and that he would have more information. So I expect at our very next meeting, I can tell you what bills are still alive and what we have to worry about.
Okay, thank you.
And if you do have specific concerns that you hear about a bill that really worries you, let me know. Penny has sent me some information. She's watching things. And when she sends that to me, I forward it to the lobbyist. So yeah, just send me anything that you're concerned about.
Okay. And also,
Madam Chairwoman, Kay.
I'm sorry?
I think maybe Penny might have had one other thing that was on the list there with regard to regulation, and that concerns gyms and maybe a request that gyms had.
Did you have something further, Penny?
The only other thing in terms of the regulations, and again, I would say just clarification, we've had some complaints about gyms requiring masks with weightlifting, and sort of that, it's anaerobic exercise, yet when you are lifting heavy weights, you are doing a lot of heavy, breathing and what have you. So we are asking them to mask up anytime that they can. So I did suggest that if we were going to, and I don't know that this has to be specified, put into an updated regulation, or just maybe it's a matter of clarifying that the recommendation is that the Board of Health, that staff should wear face covering, and patrons at all times to reduce possible transmission or exposure when people are in the gym. And the exception would only be when the activity is incompatible, which this is in the regulations with wearing a face covering, including swimming. However, a minimum of 6 foot distancing must be maintained. So the only change there might just be stating that if you can't be 6 feet away, I don't know that the change really is that different from what we've said. I guess I just want to make sure that there's no issues on your end, that you would disagree that people who are lifting heavy weights may in fact be a risk if they're unmasked.
Right, this actually came to my attention. I have several friends that do heavy weightlifting, and they're posting on their Instagram and such, and they are not here locally, are not wearing masks. And it made me think about our language. I think they're getting away with it. They're not doing it, therefore getting away with it. So I think that, it's definitely, I don't know if it's the way our language is written, or if they just are ignoring the safety precautions. But I definitely know they're not. A lot of them. I've seen plenty of pictures.
Well, and I will say, yeah, we've had a gym who is requiring it, and people are complaining because they're requiring it.
It sounds like this could be handled by guidance about distancing and masking.
Yeah, it seems to me the gym is probably one of the, I mean, it's clearly one of the riskiest places to have people breathing without masks because you're breathing heavier than usual.
Yeah.
And spewing further than usual. And if Steve Pritchard and Dr. Sharp can play tennis with a mask on, they can lift weights with the mask on. Is that right, Steve? You can do it, right?
That is correct, Carol. Thank you.
Yeah.
They won't
I know they're
even,
playing tennis with masks on and they seem to have survived, so.
And those free weight lifting areas are not that big. That's not a huge area over there. So you could probably squeeze in one or two, maybe, depending on the gym. But, you know, I'm kind of like, okay, you big guys, quit being babies and put your masks on. You know, you can do this.
This sounds like more of a blatant ignoring of the regulation as opposed to the way it's written.
That's kind of how I feel about it. I mean, I really think we just need to get, you know, maybe focus on them a little bit. Like we had to focus on like you guys had to focus on the restaurants and on the bars. You know, I understand people wanting to work out. We're about to climb the walls, right? But they can do it safely.
So
at the Y, they exercise. Once you get on your pieces of equipment, whatever that is, you can take your mask off. That's the way they do it.
Yeah, the complaint is not about being on equipment. It's more about the free weight, have heavy weight lifting, not always, but free weights. But I'm getting validation that there's agreement that what we mean in our regulations is that they should be masked unless they are clearly more than 6 feet apart.
Yes. Yes.
Okay.
I absolutely agree with that.
I think my friends are being big babies, and a lot of it's when they're doing those big squats, and you know there's not enough room, you know. And you're right, Carol. They're breathing harder, and it's just, I think they just need to buckle up.
That's why they limit the number of people that can be in the weight rooms. And I don't know about the times I go there. So it's a big room, and they only usually have maybe 3 or 4 people in there at a time, but I think their maximum's 10. But the distancing is very important. And you're supposed to clean your equipment before and after, and your hands. And they've got lots of sprays around. So
I don't think for a minute that you can't spew farther than 6 feet when you're exercising.
oh, absolutely. Yeah, that'd be more like 10 to 14 feet. I mean, you can blow that out a fair distance if you're sick. Now the good news is people that go exercise, I mean, you can have no symptoms, but at least there generally aren't. When you're sick with the flu, you don't feel like going to the Y or exercising, doing anything. Feel like crawling into a hole. I've been pretty sick like that before.
Well, I think we should just keep it the same and maybe increase education and outreach.
You're most contagious 2 days before you have symptoms.
Exactly. Well, you are contagious. I don't know about most, but you certainly are contagious. When you're really contagious is when you're blowing out fomites, sneezing, coughing, et cetera, et cetera. And but you are definitely contagious before you get symptoms.
Anything else you need from us on that, Penny?
Not on that. And then local health maintenance, the one piece of new business.
Okay.
Are you ready for it?
I am.
So I'm bringing this to you because it's a budget item. We did submit our local health maintenance request, but as we had talked about this within our department last year, and it just kind of with everything slipped by us. But we are getting ready in March to move back to our new building. And we have a lot of old birth and death records that are fragile and in very old binders. We would like to replace all of them and get everything in nice, new, appropriate binders to protect them. It's not necessarily, the binders are not cheap, so I am requesting that we do a carryover request in our local health maintenance fund. It could be as much as $10,000 because there's a lot of records. But if you are okay with that, then we will submit that to the state. And then if they okay it, we will add that to our budget and purchase those binders throughout the year and get them transitioned.
So do you need a motion?
Yes, please, because it's a budget item.
Okay.
I move that request be made.
I hear a
I'll
second.
Yep, second, I'll second it.
Okay, a motion's been made, it's been seconded. We'll take a vote. Cranner,
Yes.
Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. Motion approved.
Wonderful, thank you very much. You're going to love our new space when we get over there.
If we ever get to go anywhere in person, you mean?
Do you have any idea of possibly when we can all get together over there?
Well, all together over there, no, I do not. However, we anticipate that we will be moving over probably in the early part of March.
Oh, that's exciting.
Sounds wonderful. Maybe we could visit one at a time.
We could probably accommodate that.
Hey, real quick, did you ever follow up on hiring that company to do the scanning?
No.
Okay.
Yep.
I'm wondering if getting them to scan them would, well, I know us having all of our plats scanned and digitized was definitely less than $10,000. Because then, maybe the recorder's office, we've been offering to help assist in microfilming. So if departments can get the discs imaged, since we have to keep them forever and ever, the images on disc, then we can help pay for the microfilm.
With these particular ones, and we want to talk more even kind of offline, because microfilm won't help us, because these are books we get into regularly.
Okay. That I understand. Yeah, but I mean, having them digitized might be really nice.
Yeah.
Okay. All right.
But I will say that just forward, I call it the vault for the records, has about 20 years worth of growth for storage on those records. So.
Yeah, I totally understand.
Yeah.
All right. Well, maybe it's something, I can help you out with.
Absolutely.
Okay, board member comments again. Mark, you sent out an email about an in-service that's coming up from public health about racial being a problem in public health. I tried to go on that site today and there's no mention. You can register, but there's no mention if there's a cost involved. Do you know if there's a cost involved?
No, I think that
I registered.
Are you registered?
Yeah, I
registered today.
Yeah, I registered today with no trouble.
Yeah, it's
right.
free.
I mean, that's kind of exciting. That's exciting.
There was no cost.
No, and then I got an email sending me a Zoom link for it.
And then I forwarded it on to a couple people that I know would be interested. Yeah,
Okay.
go ahead
Right.
and register for it, Kay.
Well, I was going to encourage everybody who could, if
We already have. Yay.
go ahead, but I think I'm the one that has it. Although I'm not sure if I have to be in India or not on that date, but I'm going to check, and if not, I'm going to register immediately.
Yeah, thanks for
Anything
sharing
else?
that, Mark.
Yeah, that was great, Mark. Thank you.
I'm looking forward to it.
Mark, you're just hitting it out of the park this week, these
Oh, I had to get my stats book
This
out
month.
to figure out those charts.
Does anybody else have anything else? Well, when is our next meeting?
Up to you.
Penny, does the board have, do we have any more to-dos? I know I did I'm working on my conflict stuff. I know we owe
We
you
need to
that.
plan. We need to, that's probably the next meeting is whenever
Haven't
that's
gotten
ready.
that done
That's going to dictate our next meeting date, I would imagine.
Ashley, I think you were asking about the conflict of interest and the acknowledgement things. Yes, that is due. Being out of the office has thrown me out of a lot of things, but that's due this week.
Okay.
Is anybody been able to fill that out online? I can't get it done. I am having more trouble with this stuff lately.
It's a PDF, Carol.
I saved it as a PDF and I could write my name on it, but I couldn't answer the questions.
So
I wound up printing it out and filling it out by hand and mailing it in.
Yours involves paper. We don't do paper.
what?
I'll set you up.
Yeah. One trick is hit fill, and then check mark, and you can pull a check mark down there.
Yeah.
Check mark. Okay, I'll give that a shot.
Yeah, if you use fill, then you can type into the lines and stuff.
I'll have to look at that and see if that makes sense to me. But yeah, I'll give it a shot. Because I looked at, I could fill out my name and all that stuff. I just couldn't fill out any of the things on the form.
If you can't, then let me know and I'll convert it for you.
I'll get my grandsons over here to fill it out for me.
Yeah, I usually just have one of my kids do it for me, but I just.
So we owe Penny that this week by Friday.
Yeah.
Tomorrow, you want them tomorrow?
If I could have them Thursday, that would be wonderful.
Okay.
Did you get mine, Penny, in the mail?
I have not been in the office, so I don't know.
Bob, you use snail mail?
Mail?
I did.
In the mail?
Like Carol, I just printed it and signed it and sent it.
So you're saying you want them by next Thursday, the 25th, correct, Penny?
This Thursday.
This Thursday.
I gave myself a sticky note. I have a sticky note right here to do it. It's on my computer now.
Thursday, the 18th. Okay.
Anything else we need to do?
Set your meeting.
Yes.
When in March? Oh.
Let's see, I'm trying to pull up March.
Well, what I was
How many
saying
weeks from
before
now are we
is,
going to do it?
should we not wait for the strategic plan to be ready and then set the date for that and make that our next intent? Like, is there any word on that?
I do not have, I've not heard back from Sally about that. That has been sent off, so I would expect it any time, but I don't have a specific date.
All right, maybe we set our next meeting date and you tell her that we need it by then, by a week before then.
Sure.
Well, the 2 weeks from today would be March the 2nd. And if we went 3 weeks, it'd be March the 9th.
Let's go for 3 weeks. Let's go for 3 weeks. I'm not sure we have enough stuff to
That'll
do.
give her more time to get it to Penny anyway.
So that's the 9th. That's county council too.
Yeah, I'll be at the county council meeting that night, but I can have another attorney join if you want to keep that date.
Yeah, I'll be at county council that night too, I'm sure.
We have a meeting at 4, so.
What about March 10th?
Well,
I think I would like for us to kind of move off of Tuesdays because those are really busy days for Penny and Mark.
No, you're not going to really do this.
I know. Well, we go at 4, but still, I know it's a lot.
I just changed my other conflicting board meeting to Wednesday night, the 10th.
I can do even earlier on Tuesday. I can go earlier on Tuesday. I just am running.
Can we do Thursdays?
What about Thursday?
We can do, how about Tuesday?
March the 11th.
That would work for me.
I'm okay with that.
I can do that anytime on Thursday that day.
Ashley, you're saying no?
No, I'm wide open.
Okay,
I'm
March the
tied up in the
11th.
early afternoon.
I'm sorry, George, say that again.
I'm tied up in the early afternoon, but 4 o'clock would be okay.
I like the
Okay,
4 o'clock meeting time. It works out well.
Yeah.
is everybody okay with March the 11th at 4 o'clock?
Yes.
Yep.
Yes.
Okay, that'll be our next meeting.
Excellent.
That work okay for you, Penny?
Yes, it does.
Margie, are you okay with that?
Yes, that works for me. Thank you.
Okay. Dr. Sharp, you're okay with that?
I believe so. Yes.
Okay,
Excellent.
that's it. March the 11th at 4 o'clock.
All right.
All right. Thank you.
Sounds good.
Buddy.
Okay, have a good one and let's hope that the snow melts soon.
Oh, I love it.
Well, I'm coming back on Saturday, so I want a little warmer weather. I've missed all the bad weather. I'd like to have a little warmer weather when I get back.
You
Supposed to be in the
just bring
40s next
away.
week, so.
You do realize that a lot of snow means a beautiful fall.
What?
Every
I did not know
Okay,
that.
I didn't either.
To me, when it melts, that means spring is coming.
It's true. The blanket of the snow
Yeah.
provides the deep roots and allows fall to last longer. The leaves stay on longer. It's true.
There we go.
Okay.
Have a good one.
Sounds
See
good,
you on
guys.
March the
Thank you
11th.
all.
All
Stay
right.
safe.
All you should do, guys.